Good morning, friends. Let's today discuss about liver analysis. Let's find out what pathologies or disease we can predict after the liver analysis. So first of all, we will try to find on the discussion about the common bilirubin level. The common bilirubin level is 8.5 to 20.5 millimole per liter. On behalf of it, we can easily find which kind of jaundice we have, whether it is hemolytic jaundice, parenchymatous jaundice, or obstructive jaundice. On the analysis, when you can see the increased amount of indirect bilirubin as compared to direct bilirubin, and there is the presence of the stercobilin and bilirubin is increased, so we can say about hemolytic jaundice. But when we see the amount of the common bilirubin is increased and the presence of stercobilin is there, means there is no obstruction. The stercobilin can easily pass to the feces, means this is the case of parenchymatous jaundice. But on the analysis, when you see stercobilin is absent, means there is some obstruction, and we can say it is obstructive jaundice. Then the condition of dysproteinemia. Sometimes the liver analysis shows us the condition of dysproteinemia. So what is the condition of dysproteinemia? The main factor which determines the dysproteinemia is the content of albumin and globulin. When globulin is more than albumin, this condition is called dysproteinemia. Generally, the level of albumin is 52 to 65% and the globulin is 35 to 48%. Sometimes this condition become reverse, means albumin will become 48 or 38 or 35 and globulin will become 62 or maybe 60. Then globulin will be higher than albumin. Their condition will be called dysproteinemia. Let's find the causes of inflammation. How we will find on the analysis, is it chronic inflammation or acute inflammation? You need to see just four things: the level of the alpha 1 protein, alpha 2 protein, and beta and gamma globulins. So when you will see the level of alpha 1 and alpha 2 is increased, then we can say it is acute inflammation. And when we see the level of beta and gamma globulin is increased, then we can say about chronic inflammation. For example, like the level of alpha 1 become 8 and the level of alpha 2 become 18%, then we can say it is acute inflammation. Remember, if alpha 1 is increased and alpha 2 is normal, then we cannot say about acute inflammation. We can say about acute inflammation only when both alpha 1 and alpha 2 is increased. If beta normal and gamma increase, then also we cannot say about chronic inflammation, because chronic inflammation is only when the level of beta and gamma globulin both increased. Then additional test to find out whether inflammation is there or not. So we have sublimate test, that's normal value is 1.8 to 2.2 ml. When inflammation is there, the result of this test decrease, and in case of thymol test, the normal value is 0 to 5 units. But in case of inflammation, these units increase more than 5. If we discuss about Waldman test, it is the also indication for the inflammation source, whether it is acute inflammation, chronic inflammation, or normal condition. If in the Wiltman test result shows you 4 to 7 test tube, like there will be written Wiltman test 6 test tube, means it is normal. If it is written Wiltman test 3 test tube, means 1 to 4, the test tube number is 3, means acute inflammation. And if the test tubes are from number 8 to 12, then we can say about chronic inflammation, means, like for example, if I can say Wiltman test 11 test tube, so what will be your answer? Your answer must be chronic inflammation. Then on behalf of fat metabolism, we will also describe the function of liver. Like from the fat metabolism, what we can say, we can find two syndromes. First is hepatic insufficiency, or you can say liver insufficiency, and the second is cholestasis. So we have the three components: cholesterol, lipid, and phospholipid. You must remember their normal value. Cholesterol is 3.1 to 6.2 millimole per liter. Lipids are 5 to 7 gram per liter, and phospholipids 2 to 4 millimole per liter. So, if their value is increased, means this is related to the syndrome of cholestasis. If their value is decreased, then we can say about hepatic insufficiency. But remember, two factor must be increased or decreased to say about the syndrome of cholestasis or hepatic insufficiency. Then on the behalf of liver enzymes, AST, ALT, and ALP, the normal is 0.1 to 0.68. It is for AST. For AST we have 0.1 to 0.45, and for ALP we have 0.5 to 1.3. If the level of ALP is increased, so we can directly say about syndrome of cholestasis. Syndrome of cholestasis. Now, this is the analysis, and we will discuss about this analysis. As you can see, the common bilirubin is 16 millimole per liter. And we remember the level of the common bilirubin is very high here, and we can see bound bilirubin, and we can see direct bilirubin, and we can see here unbound bilirubin is increased as compared to bound bilirubin. Bilirubin in urine is absent. We can see presence of stercobilin. So if stercobilin is present, means it may be hemolytic jaundice or it may be parenchymatous jaundice. So our task is to find whether it is hemolytic or obstructive. So we can see stercobilin is present and increased amount of indirect bilirubin. So it is the symptom for hepatocellular jaundice. As we can see, the level of AST is norm, ALT norm, alkaline phosphatase norm, cholesterol norm, phospholipid norm. We can see the level of common protein is also normal. Albumin is more than globulin, so there is no dysproteinemia. We can see A alpha 1 is 6 and alpha 2 is 9. Alpha 1 is increased but alpha 2 is normal. So we cannot say about inflammation. Beta and gamma are in normal value. Thymol test zero point 0.8 and sublimate norm and Voltman 6 test tube. And we say if the Voltman test is 4 to 7 test tube, then the condition is normal. So we discuss about this liver analysis. So what will be the conclusion? The increased amount of common bilirubin, especially we see the unbound bilirubin is increased here, so it will be hepatocellular jaundice.